very thrilled to have Esther Dyson here. She's one of our longtime heroes here, and she was born in Zurich, Switzerland, to the prominent mathematician Verena Huber Dyson and her physicist and future writer Freeman Dyson. So there's good genes and good culture there. And of course, she's famous for working a lot early on in the digital revolution, computers and so on. But she's got something special to talk to us about today in terms of putting these things we know about human nature and society and so on to work, to actually trying to affect social change, boots on the ground for sure. Please help me welcome Esther Dyson.
I'm not going to talk about the internet, tempted though I am. I'm going to talk about what I've done since. Now, I've had a wonderful life. I trained as a cosmonaut. I did a lot of internet stuff. But a few years ago, I began to get more and more interested in healthcare. Press the right button. And I asked to be a judge on the Healthcare X Prize. The idea was take a bunch of people, do something to them, assess the cost versus the improved outcomes, and give somebody a prize. For a bunch of political reasons, that never happened. But I still began to think more and more about healthcare. And I began to wonder, does this really make sense? Healthcare is a repair job. It's extremely expensive. We do it when it's too late. And we've got more and more evidence about all of this stuff. Here is how we spend, I won't go through this chart in great detail, but we spend a huge amount of money on healthcare. We spend very little on prevention. As a society, we spend too little on healthy food, and we get awful results. It's been interesting listening to all the talks this morning. You know, most things are getting better. And yes, you can argue about energy and what's happening and so forth, but more people are rich, more people are not poor. Peter Diamandis and the singularity, people are talking about an era of abundance. Yet somehow, the wonderful things that evolution created, these human beings, also have in them, if not fatal flaws, destructive flaws. The stuff that is good for us in small amounts ends up being bad for us in too great amounts. It used to be hard to get alcohol, to get sugar, to have the luxury to sit around, the way you've been doing all morning, by the way, to eat pastry and cookies instead of grains and snatching food. And it's actually decreasing the sustainability of human beings. Our own evolved predilections are bad for the sustainability of individuals. It's probably not going to kill us off, but it's definitely creating, it's worsening the Gini coefficient. Health and economic success are inextricably linked. But that was still ahead. I started getting interested in the quantified self. How many of you are wearing Fitbits or something like that? Yeah. How many of you have found it to change your behavior? A few. And of course, the people who wear these things are more likely to be interested in changing their behavior. How many of you read the book by Juan Enriquez, Evolving Ourselves, which, by the way, I think would be a great speaker for next year? Evolving Ourselves. This is about intelligent design, or stupid design, but at least human purposeful design. The world is fundamentally changing, and on one hand, you have a lot of data. We are much more able to predict what's going to happen to people. Insurance companies really, they're in the business of prediction. They exploit their predictions by making money off understanding what's going to happen. But they're no longer allowed to make money at any large amount off predicting human health because it's too easy to predict, and they would simply avoid all the risky people. So there's a certain amount of responsibility that now faces us. And I thought something must be done. But to quote Carol Tavris, perhaps not by me. I was about to give a speech about how somebody should, instead of a healthcare X Prize, do a health X Prize. That was 2 years ago. And I realized that that's a really terrible speech. So in order to give a good talk, I founded something called HICCup, Health Initiative Coordinating Council. It is not really scientific. I'm somewhat abashed to talk to this group of scientists and science believers about what I'm doing because it's extremely, as Michael said, boots on the ground. It's an attempt to prove something that I believe rather than really an attempt to test a hypothesis, though I'm open to the possibility that we're wrong. But it seems to me, fundamentally, we know enough to do a much better job of helping people to be healthy. And it's not a question of buying Fitbits for poor people or universal health care. It's something deeper and much harder, because health is not produced through individual will. It's produced by growing up in a community where the people around you are healthy, where the choices you make are shaped by the choices you have, where healthy food is easily available. But in our nice, evolved world, free enterprise, which I believe in, has become extremely good at predicting what people will like and not necessarily what's good for them. There are externalities, just as there are externalities in fossil fuels. There are externalities in a lot of things humans consume that may be good for them in the short run, but in the long run cost them and ultimately everybody else a lot of money. The challenge is, how do you invest money up front in keeping people healthy, in producing health, in seeing health as an asset, rather than simply looking at health care as spending after the fact? So I decided to try this experiment and constructed it very carefully. Most health interventions are like peeing in a reservoir. They have absolutely no visible impact. Try some heart disease prevention program. Yes, a scientist can go in, he can detect or she can detect a 0.2% deviation from the standard, but it's nothing that persuades anybody to change their behavior. I mean, that's clear. So I decided to find instead 5 bathtubs and to pour rose water into them and see what would happen. So the idea was, and this is long and complicated, and anybody who wants to talk to me later can hear more about it. We now have a team of 4 people, and we put out a call for communities of under 100,000 people, i.e. the small bathtub, and that were physically, geographically remote. In other words, not a part of the South Bronx, not a suburb of Baltimore, but a place that was remote enough so that whatever happened in that community pretty much stayed in that community, both so that what you did would have an impact, and so that it would be much easier to collect data about what was going on without necessarily instrumenting every individual person. Because this was not about finding a group of people online to try something. This was about changing where people live and what happens to them. So we got 42 applications from around the United States of communities that met our criteria and that had some kind of leadership entity that was legal enough that it could sign a document and send in this application. One of them was a doctor from Georgia who thought we were handing out money. But the rest of them were people who really understood this idea. It was kind of an in situ business incubator or accelerator for the business of producing health in your own community over 5 years. 5 places, 5 years. And we wanted them to be diverse in a number of ways, not the best 5 places we could find, but the best group of 5. So here they are. The blue ones are the places, and the other 36 are the ones we didn't choose, but that in some sense are a control group. So it's Lake County, California, Clatsop County, Oregon, Niagara Falls, New York, Muskegon, Michigan, and Spartanburg, South Carolina. And in addition to diversity of people and geography, there was also diversity of who the leadership group is in each of these communities. It's the mayor's task force for Healthier Niagara Falls in Niagara Falls, the Mary Black Foundation in Spartanburg, the Medicaid organization in Oregon, which has a very specific Medicaid system anyway, and is a great place to do experiments. Lake County, the Lake County Health Leadership Network, and in Muskegon, believe it or not, the Rotary Club. So here we are. We've got these 5 places. They want our help. They want advice. They want our help in not... So the basic problems are the same in each community: obesity, diabetes, substance abuse, elder care. And also in each community, pretty much the middle class has almost vanished. There's a bunch of poor people and a bunch of well-meaning rich people, and not a lot in between. So I went into this thinking more about health and knowing that poor people was a problem. I have learned so much in 2 years, and I know I'm going to learn a lot in the next 5. First thing is trade-offs. You could go into any of these communities and you could do 20 things, all of which would be useful: dental care, mental health services, transport for the poor to get to their dental appointments, change the food supply, school food, bike paths, diabetes programs. And if you did 20 of them, none of them would have any impact. Just, again, it'd be like a little trickle of water into the bathtub. If you do only one, it doesn't spread. So our working assumption, getting slight, maybe not scientific, but at least purposeful, is that about 4 to 5 big programs in each community. And then, the way to Wellville is not the only thing going on in these communities. That's very important to understand. There needs to be economic development. There needs to be better education in the schools. But if we can really accelerate 4 or 5 programs, have them interact and reinforce one another, and then measure what's going on, both within each program and the overall health of the community, we will have something. This is the way in. It's, even if you're a broken down old person and you don't need no stinking advice about not eating donuts or drinking too much, you probably care about the kids. They're politically correct. Everybody loves them. Our genes make us love them, but we do. And they're cute. So they also don't cost very much now, other than problem births, which is a big area, and I'll mention it. But in general, this is really long-term. Early childhood education, education in general, better food in the schools, teach them science, avoid teen pregnancy, whatever. Those things are wonderful, but they don't pay off immediately. So we're also looking at diabetes management, wound care for diabetics, just running hospitals better. All those things actually have an immediate positive financial impact. There's still the issue around how you pay for that, but at least you can get good results in relatively short time. Then there is the issue of premature births, teen pregnancy, which not only is very expensive with intensive care units and children who are damaged in during birth or by being born prematurely, there are real cost savings in that short term and then also long term. There's a couple of programs in the US, like the Nurse Family Partnership, that actually have carefully collected data over 20 years, and they show 3 to 4 times return on the money invested in cost savings. It's a really good return, even if you're a greedy investor. But our goal is to show that this works and then ideally get it copied. School food, this is, I couldn't resist posting this. We've spent a lot of time in each of these communities understanding their problems and trying to pull together the political and economic and cultural will to do something about the problems. It's easy to have a leadership group that wants to do this, but then you also need to reach the broader community. Another thing I learned about, who knows what HAI is? Hospital-acquired infection. It's when you go to a hospital and you get worse. I'm trying to create a new meme called jail-acquired insolvency. It's when you go to jail because you had a traffic ticket, and when you come out, your family's kicked you out. You no longer have your job. You probably weren't a paragon of society. You may have an addiction. You may need mental counseling. You may need some kind of medical treatment. You come out of jail, you don't know where to go. And we've been reading, actually in the last year, more and more about Ferguson and the business models of many police departments, which is actually to extort from the poor rather than the rich. So we're working with the jails as well. In Spartanburg, for example, I ended up sitting next to a deputy sheriff, which I did not expect. This is our first meeting. I thought I'd find doctors and nurses and maybe a school superintendent. I asked him, so what are you doing here? He said, well, ma'am, my name's Neil Urch. I'm the deputy sheriff of the local jail. We discovered we got the same customers as the mental health services, so now we're working together. And again, there's a business model for this. His jail was built to hold 496 people, and it's got about 720 now. If he can get that number down, they don't need to build a new jail. That is a huge money saving. But the guys in jail aren't quite as politically appealing as those cute little kids. So that's what we're working on. None of this is going to work if we can't make it profitable for large companies and various, for the business community to make money off it. It's not going to be sustainable. Yes, you can have taxes to do some of it, but we're trying to figure out how to make it easy for companies to make money selling good food. At the same time, those of you who care are watching McDonald's earnings go down, and they have a new CEO who's trying to fix things. Coke's sales of Coke are going down. In every food company, I assure you, there's a small little group. It's called the crisis group or the innovation group or the new menus group. And they're saying, what are we going to do? Because we're going to be the new tobacco. And we want to help these guys. We want to work with them and show them how they can design menus that actually will be palatable, how they can do marketing that will appeal to people. And it's probably not saying our food is healthy. There's probably a better way to do it that will make people want to eat it. And so we're trying to get the big food companies to come in and use us as pilot markets. But overall, this is a very complicated system that we are trying to design and then, as I said, have copied outside of our communities. The money comes in through the health system to pay for the care of all these people who get sick. It's whatever it is, multiple trillions. comes in from employers who pay for health insurance. It comes in from individuals who pay for health insurance. It comes in from individuals who pay out of pocket. But most of all, it comes in through taxes. Half of the children born in this country are now eligible for Medicaid. And our taxes are paying for that. So you may be offended at the poor health. You may be offended at how much it costs you. But you probably will begin to see this as a problem if Wellville does its job right. So the solution is to invest upfront in the kinds of things I'm talking about. Out in the real world, there are a lot of investors who want to become social impact investors. They are actually asking the so-called managers of money for high net worth individuals, we'd like to do social impact investments, but it's kind of like trying to invest in a mortgage 100, 150 years ago. In other words, if you wanted to invest in housing, you had to find somebody who needed a loan to buy a house. The market was one-offs. It wasn't institutionalized. There weren't mortgage portfolios. In the same way, you could go find 5 people and say, look, I'll give you some money to be healthy, and then you pay me back later out of the savings. So we're trying to construct a standardized market of health insurance vehicles. That is, we're going to be working with Goldman Sachs and Merrill Lynch and all these other people. And meanwhile, we're also working in these small communities. So let's take a population of 10,000 people. If you invest, I don't know, let's say my numbers are very fuzzy, but that's why I have a CEO running this thing. But suppose you invest $5 million in diabetes prevention, and you save $10 million in the next 5 years. How do you create a financial instrument that will take the money that goes in and get it back out of the system that pays for the health of these people? Right now, it doesn't work that way. We have health insurance, and if they save money on health care, they're not allowed to pay it back to an outside investor. So we're trying to create one-off financial instruments that will indeed invest in health and provide a return back to the investors, and do it in a way that will be scalable and replicable across much larger populations in the future. In the same way, we're trying to change how food is sold. We're trying to find people who might want to invest in putting fruits at the checkout lane instead of candy. People who want to invest in school food being healthy. There's a lot of magic here, but the fundamental principles are pretty simple. And that's why we're doing it in small places where there is, in fact, some hope of making it work in 5 years and turning it into a demonstration that then we hope other people will steal our ideas and do it at scale. Clearly, 5 small communities isn't changing the health of the nation. What we're trying to do in these 5 small communities, using collective action, using one-offs, using intensive focus on the synergies, the business models, and everything else, we're trying to do is collective action what fundamentally probably needs to happen in some form or other as government intervention. Ideally, and this is where I want to talk just briefly about what I heard this morning. So government intervention, you can tax sugar. It is an intervention, but it's not, how shall we say, tight-grained control. When you move from the hunter-gatherers to the farmers to the fossil fuel, I think you don't move to solar energy as much as you move to the internet, as much as you move to a world of big data, as much as you move to a world where it is almost possible to know everything. And so the ethical questions become, what are we responsible for? I go into a school, and yeah, I see, as you saw in that photo, the garbage the kids eat. I know it's not good for them. But suppose I did an experiment and I took half the school and gave them healthy food. Would it be ethical to leave the other kids eating the junk? Yet that's what we're doing as a society. If I know, I don't even need to know your genome to know you need to eat more broccoli. But if I know your genome, and I know your diet, and I know how your parents treat you, and I know your socioeconomic status, and your zip code, I can't predict the course of your individual life, but I can predict a huge amount. I can probably predict whether I should employ you. I can predict whether you'll do well in school. Maybe I can predict whether it's worth giving you extra help in school to make you a good employee. I don't know. But those are really the existential questions we're going to face. If you know what you should be doing, how can you not do it? So that's why I'm doing what I'm doing, because I really love all the science stuff. I love the internet. I love space travel. But I see a huge problem in the sustainability of human bodies and their mental health that we need to deal with. And that's what I'm spending the next 5 years of my life on. Thank you very much.